Is Caroline Tread. Oh, great. I was going to ask you if you could record it, and you're doing that. Um, my name is Caroline Treadway, and I am a volunteer with I Am ALS, as are the rest of the folks here. You're in for a real treat today as we do our panel, and we've arranged for all-star panelists here. My connection to ALS is that my younger sister, Nell, was diagnosed in 2009 and passed away in 2017. And I've been doing these panels for years now as a way of advocating for people affected by ALS and making folks like you, students, aware of the disease. I'm going to ask the panelists to introduce themselves real quickly, and then I am going to show a PowerPoint slide presentation. And then we open it up to questions and answers. And that's Bogey, my dog. Yeah. David, if you could take it away.
Certainly. Hi, my name is David Busek. I live in San Jose, California, near San Francisco. I was diagnosed with ALS in 2019 and then spent the first year of diagnosis locked up at home while trying to figure out what it all meant. I have a slow-moving case that's affected my left leg first and is moving up the left side of my body. So my left hand is getting weaker as time passes, but I'm doing as much traveling and play the flute. So I'm in a concert band and keep myself busy that way, as well as doing a lot of writing.
Wonderful. Thank you. Rick, how about you?
Hi, everybody. My name's Rick. I'm the one Canadian in the group. I live about 45 minutes from Buffalo, but that doesn't mean my football allegiances are with the Bills, although I am a fair weather fan. So I worked in Pittsburgh for a couple of years, so I do like the Steelers. And my son-in-law grew up in State College, so we're slowly becoming Eagles fans too. I'm 3 years into my journey with ALS, and that's good, as we'll see in a couple of minutes with one of the slides.
And students, you should take note of Rick's review of amyotrophic lateral sclerosis. It's not a good one. Only gets 1 star. Kristen.
Hi, my name is and all of this video was today.
Hi, my name is Kristen Rankin, and I just wanted to demonstrate why I'll have to use a speech device to communicate with you today, because you wouldn't be able to understand me otherwise. I've prepared my responses in advance because it takes some time to type with my eyes, but I'm grateful to have access to technology like this. I live in the suburbs of Chicago with my husband and 3 daughters who are 11, 13, and 16. I also work part-time from home as a faculty member at the School of Public Health at UIC. I just wanted to say that I'm an outlier because I have been fortunate to live longer than most with this disease. I don't know why, but I've been grateful to have more time with my family. Because I'm a slow progressor, I have the time and energy to share my experience on these panels, unlike my faster progressing counterparts who are struggling with new losses daily. Thank you all for being here today.
Chris?
Hi, my name's Chris Balding. I live in Spring, Texas, which is just outside of Houston. I was diagnosed with ALS in June of 2024 with a right limb onset. I think I would say that it took me probably 3 or 4 months to get over the shock of and devastation of getting that diagnosis. But since that time, I threw myself, I think, into various aspects of ALS in a personal sense and in a wider community sense. It was especially difficult in our family. My college roommate, who I lived with for 4 years, passed away from ALS. We had a very close friend who passed away from ALS. And my wife, who's from Argentina, her father lived with ALS for probably 25, 30 years. And he passed away from ALS. So it's, when I got the diagnosis, it kind of a rough deal for us for a while.
Understandably so, Chris. Thank you. Thank you. Mike, could you just introduce yourself and tell the folks where you are and when you were diagnosed?
My name is Mike Broadhacker. I live in central Illinois. I was diagnosed at Barnes Jewish Hospital, Washington University, St. Louis, in January 2023. Fortunately, I'm progressing slowly, though I am progressing. It has caused me to retire. I was a construction electrician for 27 years, so it was a big change going from being able to run 5-inch conduit down to not being able to hardly pick up a coffee cup. So that's my story.
Thank you, Mike. And last but not least is my friend Katrina. Katrina will be watching our chat function. If any of you have any questions whatsoever, please, by all means, send them to us, and Katrina will let me know that they're there.
I want to start by saying, Chris, I'm so glad you're here. I love that Southern accent. It's good to have us Southerners have to stick together. So my name is Katrina Bird, and I live in Jackson, Mississippi. I lost my partner, Dora, of 23 years to ALS 76 days after diagnosis. We had no money, no family support. We didn't know what the disease, wasn't familiar with the disease. And it was a pretty rough ride. After she passed away, I came to the ALS community. And so for the past 5 years, I've been doing ALS advocacy work. I'm glad to be here. And you can, if you have questions that you want to ask and you may not want to ask them publicly, you can DM me and I'll get your questions to Caroline and we'll get them answered. Thank you so much for having us today.
Courtney, I am going to now, I'm going to ask you, can I share the screen?
You should be able to. Let me know if not, and I will check the settings, but it should be, you should be allowed to.
Share. Okay. Let me just get to my laptop, my desktop. Can you see that woman on the horse?
Yeah, is that you?
That's my sister.
Awesome.
Yeah. Yep. Sorry about this. This was open. I don't know why it, okay, there we are. And I need to do this. And you all can see it?
Yeah, you're beautiful orange.
Very good. Very good. So here we are where I am ALS, and Kristen is right there in the lower part of the slide with her 3 daughters. We're going to talk today about diagnosing ALS, about the familial and genetic traits in ILS, the treatments, though there are not many, and how these wonderful people with this disease live with hope. On the right side of the screen, you'll see our friend Tim Lowrey. who these panels are named after. It was his idea to start them. Tim was a pharmacist with Wegman food stores and felt that we really needed education that went beyond the lecture and the textbook, and have people with ALS tell you what it's like living with the disease. I'm sure that a lot of you probably know ALS. Your first exposure to it might have been the Ice Bucket Challenge. But in ALS, it's basically a story of motor neurons deteriorating and dying, which means that the brain can't communicate with the muscles. Every 90 minutes in the United States, someone is diagnosed with ALS. And Randy Gregory there on the right is one of our really great advocates. So some fast facts about ALS. I'm not going to read every one of them. You guys can see it. But what I want to point out is that 6,000 Americans are diagnosed every year with this. If you have a graduating class of 1,200, it's likely that 4 of you will hear the words "you have ALS." Military veterans like our friend Juan Reyes on the left are twice as likely to be diagnosed with the disease. We don't know why. Approximately 35% of people with ALS experience cognitive impairment as well. And research, we don't know why people get ALS, but they're investigating environmental and genetic causes. There are 2 kinds of ALS. There is the limb onset ALS, which you see here, obviously, as the name implies, starts in the limbs and then goes into the trunk. There is the other bulbar onset ALS, where the symptoms begin in the throat and the mouth and eventually will spread into the trunk. A lot of the same symptoms are muscle twitches, the slurred speech, the difficulty chewing or swallowing. ALS is what we call a diagnosis of exclusion. Unfortunately, just as we don't know what the cause is, we don't know one specific test to give somebody so that we know for in fact they have ALS. You have to give the physicians, healthcare professionals will give a person a number of tests to rule out other diseases. Genetic testing is important. What you see here in the pie chart is although 85% of people who have ALS have it sporadically, what's called sporadic ALS, 10 to 15% of them have ALS that is passed down through the generations. This tells you, this highlights for you why we do what we do, because we need more prompt diagnosis. Beth is a wife of one of our volunteers, Bob Scannell, who advocates for prompt diagnosis. And if you read through her chart here, she began having symptoms in 2017. And by 2020, she had had a number of diagnoses, 2 surgeries, and nothing had improved in the hand that was her initial symptom. And she also was not referred to a neurologist. So she had 3 years, more than 3 years of indication without the neurologist referral. In March of 2020, Bob and Beth said, wait a minute, this is ridiculous. We're going to go see a neurologist on our own. And don't you know that that neurologist within the first 15 minutes said, I think you have ALS. They did an EMG on Beth, which tests the conductivity in your nerves. And he said the diagnosis, you have ALS. So here you are 3 years without a diagnosis, and within 3 hours, the neurologist gave her the diagnosis. That's why we do these panels. That's why we want to get out there that if any of you in your careers as physical therapists, speech therapists, whatever you're going to do, you see these symptoms, you'll think, oh, I remember I am ALS, and you'll refer your patients to a neurologist. So why does that matter? It matters because there's a very slim window for these patients to get into clinical trials. It matters because they have to, it's not bad enough that they have this disease, they have to suffer through unnecessary surgeries. And you can also ensure that these patients will have the earliest start of medicines and therapy, that they'll have a lot of time to do the things that they dream of doing, and participate in clinical trials. My sister was never able to because her diagnosis was pretty slow. Here you have the early, the middle, and the late stages of ALS. Basically, it's just growing more and more severe throughout. For every 10 people that are diagnosed with ALS, you're going to have 50% who will die in 3 years, 90% will die in 5 years, 10% may live more than 10 years. And we have several volunteers in our group, I Am ALS, who have lived that long. In fact, you'll meet a person on one of these slides who she just celebrated 21 years with ALS. So I had referred to familial genetic ALS previously. This explains to you what it is. It's basically, it's passed down through the generations. More than one family member is affected by it. They tend to have more rapidly progressing disease and symptoms at an earlier age. The children of an affected person have 50% chance of inheriting the mutation. On the left there, you see what one of the Moore relatives has called generational trauma. They know that this is going to happen time and time again through their family. They've lost 7 to date to the trait, the genetic mutation, and 2 are living with it now. So as far as treatments are concerned, it's a pretty sad story here. This disease was discovered in 1869. Lou Gehrig died of it in 1941. The first therapy, Riluzole, didn't come on the market until 50 years later. Edaravone came on in 2017, but again, what these therapies are doing is prolonging life for a measurable time, but it's not long. No therapy is on the market yet for all ALS patients that has been shown to stop the disease progression. Relyvrio was came on the market in 2022 and was pulled in 2024. Tofersen, or Qalsody, has shown very, very good results, but it's not for the the entire ALS population. It's just for those who have the genetic mutation of SOD1. And that was on our pie chart there. As far as speech generating devices, we've got the low-tech solutions on the left, and we've got the high-tech on the right. And Kristen, obviously, she's got the high-tech on the right. And these machines are just remarkable and improve communication remarkably for those people who can't speak. Voice preservation, which Kristen has done, it preserves the natural voices of people with ALS to allow them to continue speaking in their own voice. And here she is on the right, some of the resources that are out there for people living with ALS is Bridging Voice, 11 Labs, and Team Gleason. And she says, while it's not perfect on the whole, she's very happy to have her own voice back, and so are we. We love her voice. We love hearing it. As far as physical and occupational therapy, physical therapy basically focuses on maintaining the patient's mobility and flexibility. Occupational therapy helps people adapt to daily living activities. Physical therapy, again, teaches the person ways to maintain balance. We do a lot of stretching in physical therapy. The physical therapist will often help the person living with ALS with the equipment needs, like braces, wheelchairs, canes, walkers. And here are some devices for occupational therapy. Sometimes if you're going to be an occupational therapist and you're going to work with a person with ALS in his or her home, you'll go in and perhaps teach them, look around and say, geez, you need a grab bar here, you need a Hoyer lift here, etc. We on the Tim Lowrey panels endorse and support these Morris ALS principles, which are named after Sandy Morris, who was a fervent advocate for people living with ALS. She herself was diagnosed in 2018 and passed in 2022. And basically what these principles say is that people living with ALS deserve to have a part in all decisions that are made about their health care. Nothing about us without us. So I spoke of the woman who just celebrated 21 years with ALS, and that's Lowrey Knox Carey. She has posted 105 plus podcasts. It's called I'm Dying to Tell You. And it's not just about people living with ALS, it's about inspirational people living their lives. And I would highly recommend that you tune into her. I'm Dying to Tell You. And we've got Andrea Lytle-Pete, who with ALS did marathons in all 50 states. She, on her trike there that you see, she has an award-winning documentary that's called Go On, Be Brave. She co-wrote a book about her life. Mary Grace Porter just left the Invictus Games earlier this year and won a gold medal in the rowing contest. She also did a downhill ski race. And Dr. Richard Bedlack on the right there is a very well-known neurologist in the ALS world. He is at Duke and subscribes to hope each and every day. Okay, so I'm going to stop sharing there and speak with these people who are most important. Those slides are good. They're good. They gave you a basis, I hope, for ALS. And now what we're going to do is talk to everybody and thank you for your questions. So we've divvied them up here, and Rick, I'm going to come to you first. We're going to talk about diagnosis. What was the diagnosis process like for you? And did you get any other diagnoses before you were determined to have ALS?
I was just looking back at the calendar, trying to replay it in my mind, because it was during a confusing time of COVID when many things were wonky in terms of getting access. And I'd been the year prior, I'd been out riding my bike when it broke, and I crashed down and tore my rotator cuff. So I was in physio for my rotator cuff, and I'd known this this PT for quite a while. We talked about how to make my shoulder feel better, but I never even mentioned to him some of the issues I was having with my legs, because I have limb onset, and it started, down in one leg in particular. And stupidly looking back, I wish I'd been more vocal with him about some of the problems I was having. But people fluff these things off, right? It was my new Hoka running shoes that were making me walk funny. It was, I was pushing my body farther than I wanted to with these long COVID walks. Anyhow, what it ended up being was, I didn't know it at the time, but I had foot drop. My left ankle, my left foot was just starting to not behave properly, starting to slap down on the pavement in an incorrect way. So my family doctor was smart, and she referred me to a neurologist right away. Didn't even try to look at the problem. The neurologist I went to was a general purpose neurologist, and she put me through a battery of tests. And you mentioned that EMG test. I don't know if you're familiar with that from your schooling, but they basically hook those electrodes up to your muscles and give you a shock like we used to do with the frog in biology class. And we shock the battery, make it jump. So they shock you and watch how it reacts and measure it. And I knew something wasn't good because the screen was showing yellow highlights on a few of the numbers. But I didn't want to play Dr. Google. So, because, I don't know if it doesn't come up much in these talks, but we're dying, right? So if you know that you might be being diagnosed for a fatal illness, you don't really want to be Googling that and figuring out on yourself and getting that all up in your head. So, so I left that alone. I figured the system will tell me what's wrong. And we went through a battery of blood tests, and I went through 2 genetic tests, and finally I got referred by this neurologist to another one, because she said, I need to send you to somebody more specialized than I am. I thought, oh, that's good. She's recognized her expertise and her limitations. And during that period of time, my shoulder had recovered, so I wasn't seeing PT at all. My daughter is an occupational therapist, but she obviously doesn't live with us, so she didn't see me a lot either during that time. So it was all just on these blood tests and these EMG and nerve conduction tests. So when I got referred to the other hospital, they did the test all over again. It was like starting over again. And I went for a couple of sessions, and the doctor turned to me at one of them and said, "Do you know why you were referred to me?" And I was like, "Oh, no." He says, "Well, I specialize in neurological disorders and particularly ALS." So at that point, I had kind of an oh shit moment, because I thought I'd already been past that with the genetic testing. And another 3 months passed, some more testing, full MRI, and sure enough, my probable diagnosis turned into a for sure diagnosis. So at that point, the journey had been over 2 years, and so I was kind of mentally ready for whatever the answer was. And it wasn't a misdiagnosis so much as just a longer diagnosis than I would have preferred.
Mhm.
In a Canadian healthcare system, the opportunities for doctors to recommend things and have you execute on them, like surgeries, isn't quite as prevalent as it seems to be in the US with the more dependence on insurance and independent choice. So I've heard lots of tales of misdiagnoses and people getting unnecessary surgeries. I was able to forestall all that and eventually ruled everything else out. So that was it. There we are.
That's a long, long time to go
It
through.
was, but it
Yeah.
happens in 3-month spurts. So you're kind of just going along thinking, oh, next appointment, we'll know. Next appointment, we'll know.
Yeah.
And it
Yeah.
doesn't really.
Kristen, could you tell us about your diagnosis?
I was 38 when out of nowhere, I started tripping and falling on my walk to the train station. I counted 17 falls that spring, and that wouldn't be the end of them. Then one cool night in April, after coaching my daughter's softball game, I couldn't pinch my fingers together to zip up the gear bag. Shortly after that, I started noticing sporadic quivers in my arm muscles. While I didn't want to believe it, the symptoms of drop foot muscle weakness and fasciculations added up to ALS. So I made an appointment with a neurologist to start the diagnosis process. Over the following 2 months, I had all of the tests performed to rule out other diseases. I remember at one point praying for an MS diagnosis, which sounds crazy, I know. Then I cried softly through the EMG, and not only because it's an incredibly uncomfortable procedure, I knew. The diagnosis was confirmed a few weeks later. One thing I can say is that I was fortunate to have the resources at the UIC Multidisciplinary ALS Clinic because my diagnostic process was quick and accurate. But many other people with ALS have a much longer and more difficult diagnosis process, or they get misdiagnosed like Beth, who we heard about in the presentation. I wish everyone could receive the quality of care I experienced.
Thank you, Kristen. David, could you tell us about your diagnosis?
Sure. And just want to make sure you can hear me because I had to put my headset on. Okay,
Yep.
great. So I was, I first went into my primary care doctor in 2016 because I was tripping and stumbling on walks and I was rowing crew and was having trouble keeping up with the crew team, the rest of the people in my boat. So she referred me right away to neurology, and especially seeing that story from Beth, it made me feel grateful now that I did get straight to neurology. The neurologist then in 2016 gave me a couple of potential diagnoses. He wasn't real confident about them, and I looked them up and they didn't match with my symptoms. So I went for until about 2018 before I went back to see the neurologist again, because the problems were continuing to, they were happening and getting a little worse. And there I was eventually, after many different kinds of tests, diagnosed with a probable case of PLS, which is primary lateral sclerosis. And it's a subset of, it's also a motor neuron disease, but a little less, it tends to move more slowly and has a better prognosis than ALS, but still no treatments or cures for it, no significant treatments or cures. But over the course of that year, that was in April, by the time I got to August, I had an EMG, which, like Kristen mentioned, was super uncomfortable. Probably one of the worst experiences of my journey with ALS was that EMG. And after that, they confirmed that I had ALS. And it's still, PLS versus ALS doesn't really make much difference in terms of what they are doing. I would still be going to the same clinics and getting the same treatments. And then I've been attending quarterly appointments since then. So that was my diagnosis story. Long, but easier than some.
Except for the EMG.
Except for the EMG. That was miserable.
I don't know
Yeah.
where they're putting the probes on you people. I didn't have anywhere near that kind of experience.
Oh.
Maybe they got high voltage ones in America. Who knows?
For me, that there were, most of them weren't bad, but the ones that were in one particular area was just miserable.
Yeah. Chris, could you tell the students?
Yeah,
Your
so
diagnosis.
probably I would say in March of last year, I noticed I couldn't, one of those big black document clips with my right hand. And, what the heck? So I was actually in the process of getting ready for a left knee replacement surgery, old basketball injuries when I was a kid, when I was young. And I was meeting with the orthopedic surgeon, and I commented to him, hey, feel like I'm losing some strength in my right hand. What do you think? And he said, you get that checked out before we do the surgery. So this was late March of last year. And I went to my primary care doctor, told him, he said, it sounds to me like you got a pinched nerve in your neck, bothering your nerves that come off your neck and go down into your arms. Go get an MRI. And so I do that. And the results of that say, well, hey, the vertebrae in your neck are sort of collapsing, and the canals, the nerves coming off of your spine are closing, something called stenosis. He said, you go see an orthopedic back surgeon. So I do that. And they did some EMG testing and whatnot. And they say, you've got vertebrae collapsing, stenosis going on. We need to do a cervical decompression surgery where they go in through your neck, and he said, we'll put some spacers in your vertebrae and clean out the canals. Don't worry, we do this all the time. You're just getting old. This happens a lot. He said, you can stay the night for the surgery, after the surgery, or you can go home. Well, my son is a nurse practitioner up in Denver, and he said, Dad, you probably don't have it, these markers that they're seeing, but they got to eliminate ALS. So I mentioned that, and they said, yeah, you're right. We need to send you to a neurologist. So I go see a neurologist here in the Houston area, a guy by the name of Igor Churches, which he's pretty prevalent here in the Houston area. And he did all sorts of testing on me, strength testing, some really uncomfortable EMG testing. And he says to me, Chris, you're not going to have that surgery. Won't do anything for you. He said, first of all, if you had a pinched nerve in your neck, you'd have pain in your neck. You got pain in your neck? No. So he said, look, he said, I don't think you have ALS, but I can't eliminate it. We've got to do a bunch of testing. Get blood work, a spinal tap, a myelogram, the whole 9 yards. Make a long story short, he told me in a virtual meeting, everything's normal, Chris. And I went, oh, great, everything's normal. And he said, no, you don't get it. With ALS, everything that we look at, that we have tests for, show to be normal. I need you to go see a guy by the name of Dr. Stanley Appel, who he's fortunately in Houston, and in the neurology world, he's an icon. He's like 93 or 94. If you saw him, you'd say, man, this guy's not over 70. He's been dealing with ALS and MS for decades. I go to him, get more EMG testing and the whole bit. And after about 3 hours, he comes in and says, Chris, you have ALS. So, I went from thinking I was going to get a knee replacement to where they wanted to do an operation going through my neck, to where they said, Chris, we want you to avoid all voluntary surgery. We want you to avoid all stress. Surgery is stressful. That tends to increase the progression of ALS. So I've been, I still have the problem with an arthritic left knee and an arthritic left hip, and I'm trying to manage that with steroid shots, trying to push off the surgery. Yeah, so, avoided unnecessary operations, but at one point in time, it looked like they wanted to do a damn complicated operation on me.
You came very close.
Yeah.
Very close. If not for your son-in-law or son?
My son.
Yeah, yeah. Phew. Mike, can you tell us about your diagnosis?
My journey actually started after having a sternum repair surgery. I was recovering from it, and while I was in rehab and trying to get back into shape, I found that I had drop foot. I
Mhm.
kept tripping over rocks, blades of grass. I mean, if I went for a walk and I'd walk 5 to 6 miles a night, I had to walk on the right side of the road. Otherwise, I'd hang my foot up more because of the slope in the road. So eventually, I had a accident. I fell down the stairs and I hurt my hip. And I wound up going to the doctor about that. And my primary care doctor sent me to a neurologist for my hip. This started in 2020 was when I had the surgery, chest surgery. Early 2021, I went to the doctor for my hip. And from that point on, after seeing the neurologist, I saw the neurosurgeon. I had 5 complete MRIs of the full spine and head. I had 2 lower spine MRIs. I was tested for Parkinson's disease, had the spinal tap, and in August or September of 2022, my neurologist suggested I go see a specialist in the Chicago area. They couldn't get me into the specialist until February of 23. So we made arrangements to go to Washington University in St. Louis to neuromuscular specialist there. And he took all of about 4 hours to say, yeah, sorry, but you have ALS.
Mhm. So once you got to the neurologist, it was a quick diagnosis.
Yes.
Yeah, yeah. Underscoring the importance for all of you out there who choose a career where you might come in contact with someone where you see these symptoms. Think about could it be ALS? That kind of situation. Okay.
Carolyn, could I make one comment?
Sure, absolutely.
2 things. What a lot of my friends didn't know, there is no test that a doctor can do that says you have ALS. Like a doctor can take your blood pressure and say you know, I think you might have heart disease. We need to look at this. The problem or the concern is people who have ALS, you know, they want to get into clinical trials. They want to see if they can get a drug that, and unfortunately, I was able to get into a clinical trial. But if it has been more than 2 years since the onset of your disease, it is virtually impossible into a clinical trial. Drug companies almost universally have a restriction more than 2 years since your clinical trial, since the onset, you can't in.
You froze up, Chris.
Yeah, I can hear everybody else, but Chris is gone.
Yeah. Okay. We'll let him get his technical situation ironed out there. But he's right. There's not one test. It's all this tests of exclusion that you've heard everybody talk about. They have to rule out everything else first before we come up with a diagnosis of ALS. Kristen, the students would like to know your answer to this question. Have you found support in other people living with ALS? Do you think this is important?
Once I finally got my head around and accepted the diagnosis, once I finally got my head around and accepted the diagnosis, I went to an in-person support group with my husband. It just so happened that the support group located closest to me had members who were mostly grieving spouses and family members who had lost a loved one to ALS. There were no other people living with ALS there, so I felt put on the spot. They were all very loving and supportive, but that wasn't what I needed at the time. So when support groups went online with the start of the pandemic, I didn't jump to join one. Then I found this wonderful organization, I Am ALS, and started doing these panels and volunteering on a community team. It has greatly enhanced my life being involved with a community of wonderful people that just get it. I've learned a lot and have been so inspired by all the people I've met living with ALS through this organization.
Thank you. It is a wonderful organization, and it's huge. The volunteers are the backbone of this organization. There are others as well. Others that have volunteers, but they really zone in on research like ALS TDI. Hi, Chris, you're back.
I am. I'm not sure what happened.
Yeah. Okay, now let's see. Kristen, Rick, I'd like to ask you the same question. Have you found support in other people living with ALS, and do you think it's important?
Real quick, absolutely, but it's not for everybody. Some people can't. Don't like to be in a group where they see the later stages of the disease and how it affects people. That's just too much information for them. I ended up kind of falling into it, and I got past a few initial experiences. Somebody pulling up their shirt in the middle of a virtual call, showing us their feeding tube, or the first time somebody talked about their plans to do Death with Dignity. So I actually run a support group now, and we've had families tell us that, that by participating in the calls, their person with ALS felt like they lived 6 months longer than they would have, because they were just so overjoyed to have this session every week or every couple of weeks where they could come and just talk with other people in the same boat about anything that was on our minds. There's a couple other groups that feel a bit more like AA meetings. They're not my cup of tea. I like the kind of the just sit around and chat ones. And that's the way I run mine. And it's just really good. And plus the community of support with patients and their caregivers, but we're able to bring experiences from our individual interactions with PT, with OT, with SLP. So everybody learns from those experiences, and then some of those people are able to take that back to their allied professionals as well, and share what they're hearing from other people. So I think we all grow as a community because of that as well. So very powerful for us.
That's really important. That's a great observation. David, how about you? How important is it for you to have found support among people?
For me and for my wife, it's been really important. We've both gained a lot of insights, learned about new things, and have been inspired by the things that people are able to do as the disease progresses. So I think mostly I would say the same things that the people before me have said. So I'll just say yes, absolutely. It's been important for us in our family to be part of that broader community.
Katrina didn't know that I was going to throw this over to her, but I am. As a former caregiver, you can speak from the caregiver's perspective. How important is it to you to be with people like us, like people going through ALS journey, people who have gone through it before?
It's very important, and I am known for bringing the meeting down, and that's about what's supposed to happen now. And because I will speak to this. So not only am I a former caregiver, there were some unique circumstances. We don't have a lot of pride and rare people in this space, or a lot who will speak out. So Dora and I did not have any legal ties to each other. We were two women who loved each other and who shared my house. Dora was white and 25 years older than me. And so that brought about a lot of difficulties. So I'm going to talk a little bit about what happens to me when the disease resolved itself. So because I'm not legally a family member, there was no support for me. The nurse didn't, she didn't offer like what, a chaplain or a support group. Nothing was offered to me. I was just, even like when they removed her body from the house, at that point, her family had taken over. They chose the funeral home. I didn't even know that funeral home, and they just left. I had to walk back to the house by myself at like 4 o'clock in the morning after she had passed away. And I had to go back in there and face all that medical equipment and the couch where she died. And as I speak about it now, it seems almost unreal, but I came to the advocacy space because I thought I had done something wrong, because she only lived 76 days after diagnosis. And I didn't know anything about the disease. So I needed this community so badly. I don't think I would be here today if I hadn't come. And it was courageous of me to come and want to see what I had done wrong. And to get here and find out I had done nothing wrong. I was dealing with her family who was angry, and they were all white. And you have to remember, I'm in Mississippi. Some things have changed, but not everything. We just outlawed slavery, I think, in 2011, so I'm free now. And at her funeral, I was one of 3 Blacks people there, and I was the one sitting in the back. I was invited to sit in the back. And so, and then when you have this type of disease, people don't run toward you, they run away. And so basically, I was alone. I'm still alone. If it wasn't for the traveling that I do for advocacy work and maybe 1 or 2 friends who have some time or whatever to, this advocacy work is my life. So if I didn't have it, I'm sure to tell you I would be dead because I'm in the house that we shared together for a long time. You know, her toothbrush, her purse, you know, everything stayed in place. And this happened, you know, a few, maybe a week or so before the mandatory COVID shutdown. And it was just, it's been, I've learned a lot. I've gotten to learn a lot about me, a lot about her, a lot about what we did together. But there's been some really dark days. And if I didn't have Caroline's number in my phone where I could at least just text her just to say, you know, I'm thinking of you or how are you doing? It just, it just would not, it just would not have worked for me, wouldn't have turned out this way because you just feel so alone. But I have this really amazing, and I might be being a little bit too uh, self promoting, but I have this amazing social media presence that gives so many people calm and peace and joy and laughter. But I was here by myself, scared to death, and dealing with all the insults and the public humiliation from her family. I was not even mentioned in her obituary, just nothing. So if I didn't have this community, I wouldn't be here today doing this long-winded answer to this question. So
Well, that's okay. We'll take your long-winded answers anytime, Katrina. They call the ALS community what? The best community that you never want to belong to.
Exactly.
And I'll tell you, it is a tight-knit group. It is a tight-knit group. Kristen, I'm going to move to you. Thank you, Katrina. I'm going to move to you and ask you what kind of rehab professionals you've worked with.
This has changed over the course of the disease as my needs have changed. At first, I was going to physical therapy twice a week, then once a week, once that schedule became too taxing. We worked on maintaining the function I still had and keeping me as limber as possible. When I first started PT, I was doing monster walks down a long hallway with a resistance band around my ankles. 2 years later, I could barely put one foot in front of the other on the treadmill, and I had to wear a safety harness to prevent a fall. For occupational therapy, I would say in the beginning, I had visits about monthly on average for fine motor exercises and to be fitted with splints to wear on my hands overnight to make sure my fingers don't curl up and become rigid. For speech therapy, I didn't need it at first, but once I started slurring my speech and having a hard time projecting, I was referred to get a speech device by the speech therapist I see at the multidisciplinary ALS clinic. She also helped me as I started having trouble swallowing by suggesting I begin using a straw and teaching me strategies to prevent choking, like tucking my chin. Fast forward to the present when I don't have weekly visits, but have access to professionals as needed. For instance, I work remotely with a speech therapist at Bridging Voice, a great nonprofit that you may be interested in knowing about if you're going to become a speech therapist. Their services are free and they help with customizing my speech device and tips and tricks to speed up communication. Overall, the professions you all are pursuing are incredibly important for improving the quality of life for us ALS patients. So thank you for your future service.
Absolutely. Absolutely. Mike, can you speak to that question about what types of rehab professionals you work with?
I can. I have worked with physical therapists on numerous occasions for it. Really physical therapy is one of the reasons I believe that I am still in an upright walker. I really do. The current physical therapist that I am seeing has specialty training for neurological patients. That is a downside that I have seen a lot of doctors send the patients to a physical therapist, but the physical therapist is not a neurological specialist. They don't understand the difference between the I'm hurt and I need to go to physical therapy to recover, and I have a neurological disease that prevents me from doing the normal everyday life. So the physical therapist who has neurological training will work with you on ground transfers, how to get yourself up off the ground after you've fallen. That is something that everybody needs to practice. Walking, like Kristen said, they will work with you on your walking, using your walking aids. I have been through occupational therapy a couple of times. Occupational therapy, the first time I did it was through the VA, and the VA was, here's your 13 sessions. We've taught you, given you the book, the big pencil. Now go write your letters, and that was the end of the conversation that they wanted to have. I went to care in the community, to occupational therapy. As Kristen said, they give you the durable medical equipment that you need to maintain your independent living. The straps that hold your razor, the silverware, the pens for writing. Then on the off side of it is I also do massage therapy. Massage therapy, and a lot of people smirk about it, but really it does help to get the knots out of your body. Physical therapy will work on getting the knots removed, but they don't spend the time to actually remove the knot. So I go to Indianapolis, VA, every 3 months for an interdisciplinary visit where I see physical therapists, occupational therapists, speech therapists in order to maintain an independent life. And that's the important part, is maintaining independence as long as we can.
Mhm.
Is anyone in the class a speech language student? Because I feel like these days, the SLP job for ALS at least involves not just the speech language fundamentals, but also just a huge understanding of technology. Like the stuff that Kristen's working with using the AI voice generation, tying that into all the different apps that are on our devices for AAC, and using that to improve your quality of life requires a level of technical competence that not everybody has, patient or physician, right? And it's interesting how that's changing. Yeah.
Kristen put up on the chat there the link to Bridging Voice. If any of you want to reach out to them. So Courtney, can I just touch base with you? I've got about 13 minutes of. What time will we be ending? What time do you need us to end?
At 3.
End at 3. Okay. Okay, good. Good. I'd like to bring David in. How has your mindset or frame of mind about your diagnosis changed over the course of your disease?
I feel like my mindset has kind of evolved steadily with the disease as my abilities have changed. My expectations have also changed, and it's made it a lot easier for me to manage moving forward with my diminishing abilities, because each time I get someplace, I can look ahead and see that I'm going to have to modify or reduce the way that I do things in the future. So I do feel like if someone would have asked me 5 years ago whether I would travel if I was using a wheelchair, I think I would have said probably not. But now I love traveling, and we've prioritized doing that. And I've been to, I think, 17 countries and 40 states with a wheelchair. So that's an example of the kind of change that I've made in my expectations and the way I think about what it means to live with this disease.
Mm-hmm.
And then I think the other change in mindset for me was after the pandemic and we started traveling to visit family we hadn't seen in person for a while. It helped me realize how important that part of my life is, that seeing the people I love is super important. And I think, I know that's always been there, but it was really brought home as I realized that my life is going to be shorter than I might have imagined, and that absence from people for that period of time.
Mm-hmm. Great answer, David. Thank you so much. Chris, how about you? How has your mindset changed over the course?
Well, over the course, my mindset was, or has become, look, I'm going to throw myself into this. I'm going to try and do everything I can to help myself. But more so, I'm going to try and, just get involved in the ALS community. I'm involved in 3 organizations on a volunteer basis. I'm doing 3 observational studies. I'm doing a clinical trial. And I'm spending a lot of time fundraising. I've been doing a lot of that. And spending a lot of time trying to raise awareness of what this disease is and what it does. So there's one comment that I want to make here. Lou Gehrig died of this disease almost 84 years ago. Since then, there has been little progress in terms of treatments for the disease, cures for the disease, not because of a lack of effort, but because in many respects, because of a lack of funding. But to give the students a sense, this is what happens to the vast majority of people with ALS when they pass away. It affects voluntary muscle movement, your ability to move your muscles that are voluntary muscles. Breathing is a voluntary muscle movement. You can stop yourself from breathing. You can hold your breath, but you can't stop your heart. Try and stop your heart from beating. You can't do it. The vast majority of people with ALS pass away because they suffocate. They ultimately get to the point where you can't breathe. It is a very difficult thought that I have in my head that at some point in time, I can expect to be in a situation where I can't breathe. And I saw my father-in-law at the end not able to breathe. It's not a pretty sight, I can assure you.
No. No, it's not. It's not. Katrina, did you
Yeah.
have something for the students?
Yes, Rick has a question. I had someone who was a kinesiologist and anatomy teaching assistant tell me today they practice neurokinetic, thanks for all these big words, Rick, therapy, neurokinetic therapy and proprioceptive neurofacilitation. Goodness. Is this a mainstream thing?
Pathologist by background, so I don't know as much about the physical aspect of it. I haven't heard of that specifically by name,
Huh.
but that doesn't mean that it's not being used. I just kind of Googled it quickly and I think, I mean, proprioceptive feedback is something that I know our physical therapist works on, especially with gait kind of training and stuff like that, but I've not heard those terms specifically.
Mm-hmm.
I
I
never
had
heard either, and I
either.
didn't want to do a deep dive into something that was fringe, so, thanks.
Thank you, Rick. I've learned how to pronounce some new words. And Mike wants to, it was just kind of answering the last question about the how your mindset, and he says every day is a new norm.
Yes, it is.
That is
Yeah,
exactly true.
I'd agree with that. And I've heard ALS described as always losing something. I'm fortunate that mine isn't day to day, but I've talked to people who've lost things day to day, and it's very much every day is a new norm.
Mm-hmm.
Yeah. And there was another
one-
group of people, David, who had another thing for ALS. Juan Reyes says that ALS means always looking sexy. So
There's the hopeful side. Yes. Chris, you were going to say
So
something?
one of the things, yeah, I think one of the things that's important if the students don't realize this, someone with ALS, as they're losing their functional ability, their mind is 100% lucid. The ALS the person afflicted with ALS knows everything that's happening to him or her as it's happening.
Yep.
and basically nothing can be done. So sit on your hands right now and pretend you got a scratch, something on your face. You can't do it when you get to a certain point, many. And, you know, these, just the ability for independent life, and you're depending upon someone else. It is very hard for the person who has the disease, but it is
Oh, no. No.
Lost
I
him
think I
again.
know. I
He
think I
did.
know where he was kind of going with this. He was, it sounded as if he was saying that it is difficult for people living with ALS to not be able to scratch their
Mhm,
face or push their sunglasses, the normal stuff that we just would push the
mhm.
sunglasses up, scratch your head, open a computer, laptop, and it is equally difficult to have to call a caregiver, even if it's somebody you love, even if it's somebody who stands beside you, to come in to scratch your face. A lot of my
Yeah,
time was spent putting, Dora's jacket on because she was cold, or it taking the jacket off because she was hot, or scratching her head. These, it's, and Dora was in my opinion, the stronger of the two of us in our relationship. I'd always been sickly, and to watch the person who was my hero not be able to scratch her head
yep,
or lock the back door or turn the key in the ignition, these are the kind of things that keep me up at night.
yep, yep. We're gonna have to do a real quick round robin here. I'm gonna ask the panelists just to uh, give us some closing thoughts for the students. Oh, and I should probably tell you who goes first. Rick, you go first.
You can see from this, the neurologists at this point were diagnosed, have kind of done their job. And all of our quality of life from that point forward comes from our interactions with OT, with PT, with SLP. That's where all the tools and the tricks and the techniques to get the most out of what we can do come from for the rest of our journey. So thank you for your contributions to that. And if you want to specialize, I'd absolutely encourage you, because we do need more of that.
Mhm. Right, you are. David, how about you? How about just quick closing thoughts for the students?
Well, I was going to say exactly the same. Thank you for considering these careers because they are super critical. And the work that you might do to learn about ALS is also going to benefit your knowledge about a number of other neurological diseases. So it is
Mhm,
a broader base than just the one disease.
mhm. Mike, any closing thoughts for the students?
As you continue through your education into whatever OT or PT or speech and language, remember, as David just said, there are really no specialties for ALS.
Mhm,
ALS is a backseat disease, and most of the neurological courses or training or education is through Parkinson's or MS or something along that lines. It's not for ALS. However, there are neurological diseases, so they can be used, maybe modified a little bit, but used for the ALS patient. And thank you for continuing your education into it.
And Chris, any closing thoughts for the students? You're on mute.
So first of all, I want to thank the students for taking time to, have this conversation with us. Hopefully, it has been useful for them. The thing that you're going to go through your education, and then when you're done with that, you'll be in the workforce, and you may have the opportunity to see someone who has symptoms that we've described today. You'll maybe be able to advise that person, hey, I think you need to see a specialist and help the person get an early diagnosis, which is really important. But one of the things that I want to emphasize, there's this idea that ALS is a rare disease. It's not. It's thought of it as being a rare disease because there's only about 30,000 people in the U.S. that have the disease right now. 5,000 or 6,000 people are diagnosed every year, but about 5,000 or 6,000 people die every year. So you got, frankly, people being diagnosed, but then people passing away. The fact is that 1 in 300 people will be diagnosed with ALS in some time in their lifetime. So think about how many people you have known in your lifetime. So let's say it's 1,200. And I'm sure 1,200 is a very conservative estimate. 4 of those people, on average, will be diagnosed with ALS at some point in their lifetime, but typically they will only live 2 to 5 years. There are people who are fortunate that, do better than that. Don't think that this is something that is not common. It is common. It's just the insidiousness of the disease that causes people to think it's not a common disease, that they think it's a rare disease.
Right, right. And with that, we're going to say thank you again very much, students. We've gone just a little bit over. Sorry about that, Courtney. But thank you so much. We really appreciate you having us.
Thank you all for your candor and your honesty, and I know it's probably always not like easy to kind of come on and talk vulnerably about these things, but I'm sure that they have gained a lot out of it, and we'll be debriefing and talking about it in our next class. And so we really appreciate you all doing this and all of your advocacy, and I will certainly see some of you again when I do this again, but we appreciate you and thank you very much.
Wonderful. How many people do we have there? Can you just give me a head count?
17.
17. Okay, wonderful.
Thank y'all.
Thank you, students, and good luck. Good luck to you. Thanks, panelists. You were great.
Thank you, Helen.
Kristen, I will be in Chicago this weekend.
Wow. I will be in Mayfield, unfortunately.
I won't get to see you.
I'm sorry, I'll be on the phone.
Okay.
I'll email you.
Okay.
Okay, bye-bye.
Bye.
Hi, Katrina. Hi, Courtney.
Bye bye.
We made it
And I love Hocus too.
so thank you. Right. We'll see you next time.
Bye bye.